Alright then, the trochlear nerve or the fourth cranial nerve. Now its origins are from the pons, but that is not what is important. Okay, only two nerves originate from the pons. One is the third cranial nerve or the oculomotor nerve, and the other one is the trochlear nerve or the fourth cranial nerve. So, what is important for the fourth cranial nerve is what it supplies, and is there is one tiny little pathology associated with it, which is very important for medical from the medical point of view. So, the trochlear nerve is actually supplying the muscle known as the superior oblique, and you can remember it like this: SO4, the superior oblique muscle. Now, the superior oblique is like this, oriented like this. Okay, so you can imagine these are the orbital cavities, one orbital cavity, another orbital cavity, and these are the eyeballs sitting in each one of them. This is one eyeball, this is another eyeball, this is the lens. Sorry, the lens. Sorry, the cornea. And this is the nose of the person. Okay, and this is the eyeball. It's sitting like this in a. This is actually the orientation of the eyeball. This is the optic nerve. This is the optic nerve. Okay. Now, the superior oblique muscle is oriented like this. Starts over here like this, attaches to a pulley over here, okay, and then goes backwards like this and inserts behind the eye, okay, and there's a pulley over here which is also known as the trochlea, okay, over here as well. So this is the trochlea. The superior oblique starts over here from here to here and then inserts behind the eye like this, okay. So what can happen if this muscle contracts? One thing, the eyeball is going to get depressed, okay? This part is going to lift up and the eyeball is going to go down like this. Another thing, the eyeball is actually going to rotate inwards. This is called intorsion. So the trochlea, so the superior oblique actually causes two things. One thing, depression of the eyeball, and another thing, intorsion of the eyeball. Okay? So this was the basic lecture on the trochlear nerve.